Tanager is here for children, teens, young adults, and families as they navigate the many stressors of the world today. Tanager inspires, empowers, and heals by providing tools and support needed to navigate the hardships of life and overcome obstacles. Our expertise and specialty trainings offer a wide range of approaches, and we'll join alongside you to create solutions to enhance your wellness. We are here for you and your family. Tanager, inspire, empower, heal.
Tanager and the Meraki Institute of Learning proudly present Together We Rise, a series based on the RISE Wellness and Resilience Framework. For those of you who are joining us for the first time, this show is a series digging deep and bearing witness to the stories regarding challenges that youth and vulnerable populations face within systems in our community. We hope this series will inspire hope and possibility to create a ripple effect, empowering community action and encouraging you to recognize the power of advocacy. The power of your voice can be a shining light, promoting change in systems that can better offer resilience and wellness in the life of youth and families. Because when we call on our courage and show up in the midst of barriers, we offer a bright place, inspiring ourselves and others to recognize that hope is possible and to not give up, because the youth of today and future generations need us. Together we can rise.
Anne, thank you so much for being here with us today. Tell me a little bit about yourself.
Well, I am from Iowa. An Iowan, grew up in Northwest Iowa, and stayed in Iowa until, the late 90s.
Okay.
Just always had a heart for service.
Yeah.
It took a lot of different forms. When I graduated from UNI many years ago, I worked with the intellectually disabled, which is, I know, a population that's near and dear to you guys' heart, and worked there for a number of years and brought people out of the state institutions.
It's, certainly influenced the lens that you've carried then into your career.
It absolutely did. And watching the joy that their families had and seeing them in the community. And, sometimes some of the families would open up and talk about that decision that they had to make to place their youngster, in an institution. Because of their intellectual disability. We would not do that today.
Yeah.
We would, 99% of individuals with an intellectual disability, that would not happen for.
Yeah.
So we've come a long way.
Yeah.
But at that time, it was super painful experience for them. In some ways, it really changed the trajectory of their lives as well. I remember one Christmas working and went and picked up a niece of one of our residents from the bus station in Nashville. She had come on the bus Christmas Day from Chattanooga, and she wanted to visit her aunt. Her aunt was failing, medically, and she wanted to visit her one more time. And in the dark, as I took her back to the bus station, her telling that story about coming home from school one day, and her aunt was gone.
Oh, wow.
They had institutionalized her, and she'd not see her again for about a decade.
I'm sure, those experiences certainly shape seeing how communities form in general, and the way that we integrate and our inclusionary practices, and the way that we share humanity with one another. It looks different. And I'm sure that's such a huge part of your advocacy work, to know that we are richer and stronger together.
We are, and it is not those poor people or those people, and then there's us, right? It's we.
Yes, absolutely.
Yeah, and how do we make sure everybody has that opportunity to have a life of choice in the community? Love mental health. I got into mental health and just never looked back. I just, I think, again, it's the possibilities, it's the learning, it's helping people grow and change and being a part of that and watching that happen is really very satisfying.
Okay, which I'm sure was so exciting at the time to see what you saw and then the passions that were in your heart to see a brighter potential for tomorrow.
Yeah, and that there were funders looking for solutions, right, outside of kind of the traditional institution-based or clinic-based services. And so the time was just right. So went on to do more of that kind of system development and worked in Montana for a while, bringing people out of the state hospitals there and into the community, which was, there are areas of Montana that are frontier. It's not just rural, like in Iowa, it's frontier, which is, you know, a multi-mile radius before they get to any service. So how do you do that, right? And how did we get community mental health centers to think differently, you know, there to be able to meet those needs? And it was just that lifting up of people's lives and lifting up a practice, right? And finding some new service delivery methods that just, you could just see that it was the right thing to do, that people resonated with it. It was fascinating to watch people grow and change, because initially there were a lot of doubters, like, these people, you can't bring them out of you can't bring them out of the hospital.
A lot of fear.
A lot of fear.
Of the unknown, I'm sure.
Mm-hmm.
You know, it makes me think about this initiative and why these conversations are so important. And, you know, I'm just so thankful and blessed that you're here, because you have such a rich history and experience of what you've seen. And, you know, I'm at this stage of, we need to fight for a better tomorrow for our youth and families in our communities. And so with the experience that you bring to the table, now CEO, right, of Orchard Place out of Des Moines, doing lots of advocacy work, you've sat on the Children's State Board. What are you seeing as some of the biggest gaps that we're experiencing currently for kids and families?
Yeah, so you're going to ask so there's a gaps question, then there's a systems question, and I get you right. And so I'll talk some about the gaps, and I am a big believer that when anybody has any kind of health crisis, you know, whether it's a medical crisis, a mental health crisis, that, you know, quick crisis care that is compassionate, that is revealing about what happened, you know, what brought on that crisis, and meets kids and families where they're at and is supportive. That compassion is huge in that crisis moment. And we are very broken. We don't have a good crisis response system. You know, we don't even have it in our urban areas to the extent. You guys are actually kind of fortunate here that you have a better crisis response system than most places in the state, and that it's matured over time. So you have had that for 15, 20 years, and the rest of the state has not. And so we see that, you know, when somebody doesn't get that kind of response, you know, and access to those crisis services, that, you know, in a week or so, they end up, or sometimes not even that long, they end up having to be hospitalized. It's a worse situation than it would have been. So I would say crisis services is at the top of my list, and that those are built out in such a way that they meet kids and families where they're at. And so that means mobile crisis that goes into the home. That means crisis services that does not have to involve law enforcement. You know, we see so many families that don't want to call law enforcement to be able to get that help. There's just a lot of stigma around that. And I think, you know, law enforcement has done a better job, for sure, of getting training in mental health and crisis intervention, but that's not their sweet spot, right? Their sweet spot is, you know, community safety. That's what they do. They're really good at it. And so we need to save them to do that work and let mental health folks go into the homes and really work with kids and families when they're in crisis. And then if they need to have some kind of a crisis stabilization experience, that is available for them, that is not a hospital. You know, for those hospital beds, it's just really critical to save those for those situations where truly that youth needs to be somewhere really, really safe and secure, and have that level of medical intervention as well as clinical intervention. So if you have a good crisis system, you not only respond to people that already know they have a need, right, and help them kind of reevaluate where they're at. Maybe they had a mental health provider and they dropped out of services, you know, getting them reconnected, right? But I think the overall piece of it is making sure that they know that there is somebody there, they're not alone, right? And that they can get what they need. Yeah.
We're blessed to have a little bit greater access to care than other places in the state, but certainly, you know, we know that at times the level of needs that a youth or a family have doesn't always match the services available for those needs. You know, one of the things that I think about the history of our state in the last decade and moving into managed care is how much that's changed the system of PMICs, or more residential care facilities. And as you said, you know, there are times that kids can find themselves in this chronic crisis and there's not then the level of outpatient services to meet their needs, so they end up in a place like a PMIC facility where they're staying 24/7.
Well, there was a huge shift, paradigm shift made in 2008. So I'm going to go back a little further, but I think it was significant. And that was when the state went from having to have all children adjudicated, children in need of assistance before they could access PMIC care. And so that meant parents had to sign their rights away. And while legally that may not have been entirely true, it's sure how it felt for them. And I experienced that with families, you know, when I worked at Orchard Place back in the 80s and 90s. That feeling of I'm giving my child away, I had to say I couldn't meet their needs in order for them to get this level of care. And other states were already doing this, so we were a little behind in that regard, but allowing families to make that choice voluntarily for their youth to get that kind of treatment was that was a game changer.
That was pivotal.
It was a game changer. And today, you know, we went from 100% of our, you know, 103 beds, you know, being court-ordered adjudicated, to today maybe 5% of those beds are court-ordered or adjudicated. Kids that have been in the child welfare system or in the juvenile justice system. That's a huge change for families, and it took away so much power from families, and you really are trying to empower them, right? You're trying to give them more choices and options, not take them away. And I think it was demeaning to families. Sometimes the court process itself was demeaning, kind of depended on the courtroom, you know, and the judge that you got. So that was a huge shift, and I'm really glad that the state of Iowa chose to do that. And I think along with that then came this change of we have to have families involved in care. Talk about it today and you think, gosh, that was almost archaic, right? To say, now your child's gonna be admitted and they aren't gonna have contact with you for a while. It's like, we would not do that today, because what we know is that kids need their families like they need air to breathe, right? You don't take that away from them. So that, and involving families in treatment planning, you know, bringing their culture, you know, and what's important to them as a family to the table and using their strengths. It's a different kind of partnership today than it was, you know, back in 2008 when we made that change. A very different kind of partnership where you actually come together with the family and you provide that care and that experience that they and their child need. You know, a lot of the kids that come to us have been traumatized in some way. Some of it really severe, you know, and some more just as having a mental health disorder is traumatizing in and of itself. And, really learning that what trauma does to kids and families, and how it alters their reality in some ways and heightens their need for safety and security, right, and predictability. And so I think that has been pivotal as well in seeing, you ask the question, what's happened to you, right, instead of what's wrong with you.
Yeah. Our philosophy and the way we look at the work and how much that's changed over the last decade has certainly improved systems in the way that we interact and know about kids' brains and the way they develop and how we
Absolutely.
support them and their families and come alongside them because they are the experts of their lives. But the state really felt like we needed to shorten those length of stays to be much more about stabilization versus stabilization and some groundwork to prepare them to enter back into the community. What do you see from your perspective?
So first of all, let me just say, no kid ever said, gee, I want to spend, 6 months in a residential treatment center. No kid ever said, sign me up for this, right? I think that is important to them to get back home as quickly as they can, right? I think for their families, it's a relief sometimes so that they come into treatment and they can take a breath, right? They've been so worried about their youth's safety, their future, and they finally kind of take a breath and kind of get themselves kind of together, right? Maybe do some self-care, things they really could not do very well. They don't feel so isolated anymore. They have hope, right? I think the longer someone is out of a family, the harder it is to go back. And that is just human nature that, people start to fill the roles that are missing. I think it's important to get kids back as soon as we can. I just think it's important for the overall health of that family and for the child. And, there's going to be a certain amount of anxiety and fear, going back home because there was a lot of experienced failure. Right? And a lot of not feeling safe. And I don't want to go back to that. Well, you're not going back to that, right? You've made vast changes while you're here, as has your family, and being able to support you. Now, on the other hand, what we've seen is that, when kids aren't ready and we're getting pushed, right, by the MCOs, the managed care organizations, to make those choices, one of the things we're missing, it's another gap, right, is that we don't have that next level of service readily available across Iowa. So we take kids from all over the state, as you do, and so there's not functional family therapy or intensive in-home services. Sometimes there's not even really that in-home behavioral health intervention service that's available in their community without a wait list. And so there's not that next step that's available for a little bit more intensive intervention to help them, right, integrate back home, right? So, I know one of the things that we have started now is that, and it really kind of grew out of this, was we have our therapists in our PMIC program are providing some of those aftercare therapy services. Even if they're doing that and can't get paid for it, if we're doing that in conjunction with their home therapist, right, who's back in their community, and really building some of those bridges between this is what happened when they were, in treatment at Orchard Place, and this is how that translates into being back home. Right, and so that's been huge, and the psychiatric services.
Yeah,
is
the ongoing
same
medication management, right?
A youth goes home, they have a crisis, they are going to have a mental health crisis when they get home, right? I'm sure they will. If they don't, they're really, really fortunate. And so they have a mental health crisis, they go to the physician or the psychiatrist. Well, what do physicians and psychiatrists know how to do? They know how to change medication. And so of just kind of trying to get them through the crisis, it's like, well, let's tweak this medication. And now we're saying to families, give give us a call before you do that. You know, let us talk through, you know, let our psychiatrist talk that through, you know, with the vision. We may agree, you know, at the end of the day, but give us that chance to consult on it. Because usually there's been a period of time where we've really worked to titrate, you know, those medications to get them where the child needs them to be. And that means not too much, right? And just enough, you know, to get them where they need to be.
You know, when I hear you talking, and I just think about like, oh my goodness, what if we could do this service and this service and this service? You know, even when the kiddo's in the PMIC, you know, could they have someone still visiting the home and doing parenting stuff every week? Could someone be there for multiple hours during a home visit to be coaching and modeling? You know, like all the
Yes and yes, but
what?
the funding stream doesn't allow for it today. I think that's a big part of it that drives, you know, what we provide is the ability to get reimbursed for it. And I will say that I see more flexibility in that again today than I have for probably 5 years or more. I see our partners at the state level really looking at those things like, what can we do to help kids get back home and stay home? Or what can we do to keep kids at home? And I think that there are more exceptions being made and more regulatory changes that are being made to help accommodate that. I think it's probably all of the above that has created that change, but we can do more of that than we have. I think that sometimes, you know, it takes a while for practice to change. You know, having been in this business a long time, I can tell you that there are great ideas out there, right? And the devil's in the details always, right? In terms of implementation and really making sure that the culture is changing along with adding that new piece, right? And so that culture has to be, okay, you're gonna have this new service maybe, I have an adjoining or service that complements it, and how are we going to work together, right? So it isn't just that individual service that we're adding, but it's also how the whole system works together, which I would say today we have pockets of brilliance, right? Where we work together very well.
You know, we're going to start to promote in the next 5 years in-home family therapy, MST, FFT, all these things that may now be reimbursed by insurance, and how exciting that is. And where are we getting providers?
We have to invite people into the field, right, at a younger age than we do. And we have to support them differently than we have.
We have to compensate them different than we have.
And compensation is, you know, is a lot of different things. Compensation is training, you know, compensation is, you know, a good place to work, you know, a safe place to work, an inclusive place to work. You know, those are all really important things, you know, for employees. And I think this younger generation is so passionate about people. I mean, they're on fire for this, you know. So we have a great opportunity here to really capitalize on what the younger generation is bringing to us in terms of their passion and desire, and to help them become experts and stay in this field. And we have to be able and pay. We have to be able to pay them. So I think, you know, we absolutely have to have workforce, and that means we have to have good cultures. We as provider agencies have to have good cultures, and we have to have adequate compensation, reimbursement from the funders. We have to have that, and that includes private insurance.
Having a system that empowers them to do the work that they know with their excellence needs to be done for kids and families.
So they can bring their best self to work every day.
When we seek out a service that can make our family better, that can make our community better, and then not being able to achieve that, that is a really, really disempowering feeling.
Right, right. It is not what we need to be well. And then I would say that really the other thing is to get that system of care in place. So, You know, today it is so fragmented. It's a word that a lot of us use a lot in children's mental health, as there's not clear pathways for families to follow to get help. And we even as you know, providers, mental health providers across the state don't always agree. You know, earlier when you were mentioning, you know, how we don't see eye to eye on those things, we often do not when it comes to those pathways. And so again, we have to compromise with, you know, we have to establish these pathways, and then we have to be committed to those, because that's how they get worn, right? And that's how they get used.
Yeah, you know, when I hear you talking, Anne, it's all about awareness. It's about reducing stigmas. It's about education. It's about really coming together as a community and being willing to have these conversations, look at our systems, look at where are there gaps, or where are there strengths, and how do we work together and collaborate to make tomorrow a brighter future for all kids who are experiencing struggle.
Right. So we have a lot of work to do, right?
Yeah.
We have to work with our schools. You know, we have to work with our law enforcement agencies. We have to work with other partners in the community that offer adjacent kinds of services that we don't. We have families that need a lot of social supports, and so they may not have safe, affordable housing. You know, they may not have food security, and if we want them to be able to go forward and focus on the health needs of their child and their family, they got to have those things.
Well, Anne, you bring up so many good points, and I'm so thankful for this conversation, because I think your years of experience and seeing how the system has changed over several decades is certainly can give hope that tomorrow can look different, you know, 10 years from now can look different, but we are stronger together. We're stronger with awareness of this, not just if you're working in this field, but as a person in the community, that your voice matters, your awareness matters, because either you might have someone you love, or you know that you love that is experiencing some struggle that will need some service at some point, and we want to make sure that we have the services for the needs that are out there.
Right. Yes.
And thank you for being
things
here.
so well.
No. Thank you so much for being here, being a part of this initiative. Keep on your advocacy. We are lucky to have you in this state. We are blessed beyond measure to have your expertise. So thank you again.
Thank you, Tanya.
No matter the challenges you and your family face, Tanager is here for you. Our team of specialists in mental, emotional, behavioral, and social health want to join alongside you during these tough times. Tanager will offer the tools needed to inspire, empower, and heal, while providing the support you need to build the strongest foundation for success and wellness. We'll meet you wherever you are in your journey, and together define a path to reach your goals. Together we rise. Tanager. Inspire, empower, heal.
Thank you again for joining us today and for spending time with us. We hope today's segment offered hope and healing. Today's series brought to you by Tanager and the Meraki Institute of Learning. For more information, please visit our website at www.tanagerplace.org.